Hey everyone, today we're going to continue on with chapter 14, the digestive system. So if you remember in the last lesson, we covered the basic overall anatomy and functions that you're going to see in the digestive system. And today we're going to focus specifically on the organs and function of the mouth, the parts of the mouth, including the teeth, the pharynx, and the esophagus. So if we start with the mouth, this is going to be the first part of your digestive system. It's often called your oral cavity. It is a mucous membrane lined cavity, and there are different definitions or different parts of the mouth that we're going to be talking about. So first, we have our lips, which are called labia. This is going to protect the anterior opening to our mouth, so how food gets into our mouth. We have our cheeks, which make up the lateral walls of our mouth. Our hard and soft palate. Now remember, palate was talked about in the respiratory system. This actually helps separate the nasal cavity from our oral cavity. So I'm just going to go ahead and write that in over here. Separate nasal and oral cavity. So our nose from our mouth. The hard palate is going to be the anterior part, and if you feel inside your mouth on the roof of it, it's hard because it's backed by bone. And then towards the back is soft palate, so if you press it, it's going to be more spongy because it doesn't really have that bone backing it. And then the uvula is actually of the fleshy part projection off the soft palate, and you have to see it dangling in the back of your throat. A couple other terms for anatomy is the vestibule or the vestibule. This is the space between the lips and the teeth. So if you actually have your teeth closed and you reach behind your lips in your little gum area, this is going to be your vestibule. Often people who chew tobacco tend to put tobacco in this space. Your oral cavity proper, this is what's going to hold in your teeth. And then your tongue. This is a huge muscle. It's actually the strongest muscle in your body, and it occupies the floor of your mouth. It's attached at your hyoid bone and the styloid process of the skull. So remember, your hyoid bone is the bone that's kind of located in the middle of your kind of throat. It dangles. It doesn't have no direct articulation with any other bone in your body. And then your styloid process in your skull is located on your temporal bone near your ear. The other part that's attached is something called your lingual frenulum. This is on the floor of the mouth, and the whole function here, I'm going to go ahead and start, is to secure the tongue and limit any posterior movement. So it kind of aids in a way of preventing you from choking on your tongue all the time. So oftentimes people get confused what your lingual frenulum is, so I actually looked up a little picture. It's located right here. If this is too big, it can impair your ability to speak or move your tongue. So some kids have a disorder where they need to get this cut. Last couple things about anatomy of your mouth, we have our tonsils. Tonsils is often a word that we hear because if you get things like strep throat, that's just an infection in your tonsils. Tonsils is lymphatic tissue. The whole point of it is to fight infections, and there are different tonsils. One of the two major ones are your palatine tonsils. This is located at the end of your oral cavity. So it's named after your palate, your hard palate and soft palate. And then your lingual is located at the base of your tongue. So think of like linguistics or languages. Lingual is your tongue. So here I have this picture, and I've included it in your notes so you kind of have a reference point to look at. But you have the roof of your mouth. So here's your oral cavity, the open parts of your mouth. The hard palate is going to be the part that's reinforced by bone. So you see some white spongy bone in here. Whereas your soft palate is located over here towards the back of your mouth. At the end of the soft palate, you have your uvula, which is, again, part of your soft palate. It's the part that dangles down. Right at your uvula, you're going to find your palatine tonsils. Your lingual tonsils are going to be located at the base of your tongue. So this major part is your tongue, which lays along the floor of the mouth. Lips, everyone knows our lips. Your vestibule is that space right down here between your teeth and your lips. And then here is your hyoid bone. So it's here in your neck, and it helps attach your tongue. And then a couple other things over here is you have your epiglottis, and then don't forget we have our pharynx running all around down the back. Here's another picture that shows your hard palates towards the front, your soft palates towards the back, and then your uvula that dangles down here. Now going on, now that we've kind of described a couple things in the mouth, let's talk about its major function. So the major function is chewing up food or breaking it down, and this is known as mastication. So that's going to be a term that you'll need to associate with chewing. Within the mouth, not only do the teeth help break it down, but we also have the tongue that's able to mix up this food that has been broken down, and it mixes with saliva that is being released into your mouth to help break down the food chemically. The tongue also helps initiate and allows us to push food to the back of our mouth to be swallowed. And then lastly, our tongue has taste buds to allow us to taste if things are sweet, salty, bitter, or sour. Our pharynx, remember another word for pharynx is your throat. So this serves as a passageway for foods and fluids. And we also talked about it in the last chapter, in the respiratory chapter, because it also does conduct air. There are 3 pharynxes that we talked about in the last chapter. The first one is your nasopharynx, which is located near your nasal cavity. Well, because you don't put food in your nose, we're going to just briefly refer on the other 2. Your other 2 are your oropharynx, which is located in the back of near your throat, your oral cavity, and then your laryngopharynx. This is located below your oropharynx, right towards the beginning of your esophagus. Food actually is propelled down your esophagus by the alternating contractions of 2 skeletal muscle layers, and it does this, remember the term, through peristalsis, the movement of food through the body. So here, if we look at it, your nasopharynx is up by your nose. Your oropharynx is at the base of your throat, or your back of your throat. And then your laryngopharynx is down here closer to your larynx, or your voice box. The next major one is your esophagus. This is also known as your gullet. It's about 10 inches long, and it runs from the bottom of your throat all the way to your stomach and passes through the diaphragm. The whole point of the esophagus is to conduct food using peristalsis, or this alternating contraction and relaxation, to move food through to your stomach. It is actually a passageway for food only, not for any respiratory gases to go to our lungs. So food only. Now, with talking about your mouth, pharynx, and esophagus, we have to bring up the idea of teeth. So teeth is what actually allows us to masticate or chew things into smaller fragments within our mouth. We have 2 sets during our lifetime. The first one are deciduous teeth. They're called baby teeth. These appear around 6 months of age. Once you get to about 6 to 12, you're going to start losing your baby teeth, and you'll start getting in more permanent teeth. And usually by the end of adolescence, you have all of your permanent teeth that you're going to get except for your 3rd molars. Those don't come in until about age 17 to 25, and those 3rd molars are called your wisdom teeth. Now, wisdom teeth usually do not have to be removed as long as they don't pose any issues. But if there's overcrowding in your mouth or you have pain, they often recommend you get them out. If you have a full set of teeth, no teeth missing, and all your wisdom teeth, you should have about 32. So here's a picture of average ages and when they come in, and generally where they're located, where they're looking at. So notice that the first teeth that come in for infants is usually around 6 to 8 months of age, and they're going to be your central incisors. So teeth are classified according to their shape and their function. So remember, shape dictates function. Anatomy dictates physiology. So if we're looking at this, there are 4 major teeth. They're your incisors. These are more chinsil-shaped. these are actually your front teeth, and they're adapted to cutting into food. So if you're biting into a hot dog. Canines, these are more fang-like, and these are used for tearing or piercing food. So if you're ripping off a piece of bread, you're ripping off a piece of meat. Your premolars and your molars, these are generally going to look similar. Your molars tend to be bigger than your premolars, and these are rounded. They're more flat because they're used for crushing and grinding food. Along with the teeth, a couple other things I want to talk about the salivary glands, because remember, your salivary glands are an accessory organ that we mentioned. So since these are located near your mouth, we're going to talk about them as well. I did tell my class that you do not need to know the specific names of your salivary glands, but I do for your test, but I do want to touch up on them. There are 3 that your book mentioned. Your parotid glands, these are found near your ears, just right in front of them. And when these get infected and there's inflammation in them caused by the disease known as mumps, these are going to cause you to have pain, to open your mouth or chew if they are infected. Your submandibular and your sublingual glands, both of these empty saliva into the floor of your mouth. So over here we have the salivary glands kind of labeled. Your parotid is, notice it's in front of your ear, and then your sublingual and submandibular glands are located down here on the bottom. Salivary glands are going to release saliva, which just is a mixture of mucus and serous fluids. They help function by moistening and binding food together into something called a bolus. So I'm going to go ahead and star that because I know that's a term that I've used and we will continue to use. The bolus is just a big round moist ball that helps chewing and swallowing go easier. Saliva also contains other things such as salivary amylase, and this enzyme helps begin starch digestion. So remember, starch is a carbohydrate, and carbohydrates begin their digestion in the mouth. It also has lysozymes and antibodies to help inhibit bacteria that might get into your body. Now, with all that being said, let's go over a lot of the major functions. We've talked about these functions before, but here we're just going to be a little bit more specific. Remember, any food that's placed into your mouth is going to be physically broken down by chewing with your teeth. It's going to be masticated. Saliva is also going to be produced, and it's going to mix with food to help begin your carbohydrate breakdown. One thing that's not mentioned yet is increased saliva production is due to mechanical pressure and emotional stimuli. So pressure with holding things in your mouth, but also emotional stimuli. So if you're thinking of like a nice apple pie, you might start salivating. Essentially, no food absorption occurs in the mouth. So while food does start to be broken down, that breakdown of the food is not absorbed into the blood yet to be transported to the body. After we start breaking down things in our mouth and we get a nice bolus, then we're going to swallow it. So swallowing is part of the function of food propulsion. Once you swallow it, it's going to actually move down our throat through something called peristalsis. That's just the alternating contraction and relaxation of muscles to move things through your body. In fact, your pharynx and esophagus have no digestive functions whatsoever. They only serve as a passageway to the stomach. Now, when your pharynx, it does function as swallowing. Even though that's not a digestive function, it does help move the food down into the esophagus. And swallowing goes by the scientific name called deglutition. If you've ever heard of the 7 deadly sins, gluttony is one in which people never get their fill. They're always eating. So here, swallowing is deglutition. Now with swallowing, there are 2 major phases. We have our buccal phase and our pharyngeal esophageal phase. And we're going to talk about each one of these. First, let's talk about our buccal phase. Our buccal phase is named because if you remember when we went over terms, our cheek is known as our buccal region. This is a voluntary phase. So this part of swallowing we get to choose. It occurs in the mouth. Food is chewed, it's mixed with saliva. That ball or bolus is moved towards the back of your throat or back of your mouth, and you can physically swallow voluntarily. Now, after you swallow it, all the movement after that is involuntary. It's transported through your pharynx and your esophagus through peristalsis. This food, once it starts going down, does not usually come back up, and the reason is because the tongue is going to block re-entry into the mouth. Your soft palate closes so things don't go up to your nasal passages out your nose. And then your epiglottis helps cover respiratory passageways so it doesn't go down into your lungs. Remember, again, I've talked about it several times. Peristalsis is that wave-like contraction. It's smooth muscle that moves this food down towards your stomach. And the last thing I kind of want to mention is at the end of your esophagus, there's something called an cardioesophageal sphincter. A sphincter is just a valve that opens and closes to allow food to go in your stomach, and it closes to prevent any stomach acid from getting up into your esophagus. If you tend to experience a lot of acid reflux, it's because this valve is generally not working in the way that it should, or you have too much stomach acid in your stomach. So here we have a picture. We have a bolus of food in our mouth. We have decided that we would like to swallow it, so we voluntarily swallowed it, and it goes through our upper esophageal sphincter. So notice that here it's kind of closed. And then when we go down here, it opens. Then it's going to keep going down your esophagus all the way through. It's going to go through your cardioesophageal sphincter because it's open. It's going to be released into your stomach. And that's the end of today's lesson. Let me know if you have any questions, and I'll be more than happy to help. And other than that, I hope you have a good day.